what I'd like to spend a little bit of time talking about is giving all of you a little bit of an introduction to the Global Fund, talking about a little bit of its history, its story, its impact, and then also talking about its partnership with PMI. Very quickly, the fund was really thought about as a war chest in 2001. Kofi Annan at the time called for this to a financing mechanism to be created to fight these three killer diseases: AIDS, TB, and malaria. And what happened was the G8 really heeded this call and promised to do what was necessary to fight these three diseases in low and middle income countries around the world. And the US was actually the first country to come out with its pledge to the Global Fund of $200 million. And that was really what, if you will, birthed the Global Fund at that time. The Global Fund is based on a few founding principles. First of all, it's important to understand that it is a financing mechanism. It does not implement programs. So its goal is to obtain money from wealthy donors, including the United States, but also foundations as well as the private sector. And as I said earlier, the US, since the beginning of the fund, has been the largest contributor of the Global Fund. And as many of you know, the House just passed earlier this week the omnibus, and that included at least $900 million for the Global Fund, and we look forward to that bill being signed by the President shortly. It also works on a country-driven approach. And what this means is that the Global Fund basically receives proposals from countries around the world to help them fund their strategies to fight these three killer diseases. So the countries are really the ones driving their priorities, and as long as these proposals are sound from a technical perspective, which the Global Fund does review very carefully, then they are provided with funding. It also leverages resources. When the Global Fund was first created and the US was participating in it, one of the key ideas is that for every dollar that the US put in, $2 would be raised by the rest of the world. And this really has been a very, very important function for the Global Fund. And what we've seen throughout time is the rest of the world really responding to that US leadership in financing. And then finally, it really tries to maintain a very transparent and accountable system. I think that any of you who go to the Global Fund website would probably be somewhat overwhelmed by the amount of information that is available. You can get everything from information about grants and goals, and that is an incredibly important process to the Global Fund. So all of its donors and stakeholders are aware of what it's doing. And its approach is very similar to PMI in that it does support a comprehensive set of activities, so both prevention and treatment, long-lasting bed nets, indoor spraying, as well as effective drug treatment. So results. I think this is really the key thing for all of us as we're thinking about how to move forward in funding these programs. It's really about the impact these programs are having. And since 2002, the fund has approved more than $15 billion in grants to fight AIDS, TB, and malaria in 140 countries around the world. In addition to AIDS and TB results, we've actually had phenomenal success around malaria. The Global Fund is the largest financier in the world of malaria programs. It provides 2/3 of all funding to prevent and treat these programs. And to date has distributed 70 million bed nets to prevent the malaria. It's delivered 74 million anti-malarial drugs to treat the disease. And overall has provided just under $3.5 billion to support 175 malaria grants in 83 countries worldwide. And just as far as Africa is concerned, since that is really the focus of the epidemic or the disease, they've spent $1.5 billion in 19 African countries to fight the disease. And just as a note, in November, the Global Fund actually passed its largest funding round to date, round 8. And it's important to note that the majority of the funding for that program, which was $2.7 billion, actually went to malaria programs. And this was actually because of a very significant effort, worldwide effort, that happened to work with countries to provide very, very strong proposals. And PMI and a lot of NGOs were very involved in that process. And it's a really good example of, again, how the world comes together, works with countries, and we are all able to really see progress. And in this case, 68% of the proposals that were submitted were actually accepted. So again, this is a really big improvement over past years. What are we seeing in the countries? Generally, as Admiral Ziemer said, we're really starting to see evidence from endemic countries that are starting to show significant declines in malaria cases as well as child mortality of up to 50%. There's high coverage areas, including in Rwanda, Zanzibar, Eritrea, and Burundi, and many other countries, again, are like Ethiopia, Kenya, Mozambique, South Africa, Swaziland, and Zambia are really starting to see pretty substantial reductions in malaria deaths. A couple of, I think, kind of important, unique examples. There's a region called the Lubumbo region in southern Africa, and this is made up of part of Mozambique, part of South Africa, and all of Swaziland. And through Global Fund financing, and this was actually through all three mechanisms of spraying, drugs, and nets, we've seen malaria incidents actually drop by 90%. And actually, we have some additional information in our folders about this project. Admiral Ziemer mentioned Rwanda, so I won't repeat that again. And then obviously in Zanzibar, we've seen dramatic efforts occur, and we've seen a 52% decline in child mortality from 2002 to 2005. And again, this is partly due to the work of the Global Fund, but also the work of our partners in the country. And just again, as I mentioned, the U.S. has really taken a very strong role in funding the Global Fund, and we've seen funding from the U.S. grow significantly since the very beginning. And it is important, again, to reiterate that money is leveraged 2-to-1 by other countries. And the U.S. also, I think it's important to note, plays a very significant role on the Global Fund board. It has an individual seat, which actually many seats are actually shared by countries, but the U.S. has its own seat, and again has really worked very closely with other board members as well as the Secretariat to really strengthen the work of the fund throughout the last 7 years. There is also, again, since the creation of PMI, very strong collaboration between the two entities. There's a partnership between PMI and the Global Fund through the Rollback Malaria Partnership, which I assume Matt will talk a little bit about. I think there's been technical and operational collaborations, and they're also working together to really create strong monitoring and evaluation tools so we can continue to see sort of the impact that these programs are having. So in conclusion, I think the Global Fund is actually a really unique example of what happens when the world comes together to fight a cause. And I think it's also an important example of how U.S. leadership plays into that international work that gets done. And I just want to add to what Admiral said, that it is very clear that we are in a very difficult time economically, and there are a lot of competing needs, both domestic and international. But I think what's also important to understand is over the last several years, we've made incredible strides in global health. And these are also issues that affect the poorest of the poor, and these are also the people that will be most highly affected by the global economic crisis. And again, very much understanding the pressures that we're all under, it is important to continue these investments so that we don't backslide on these incredible results and are actually able to continue to help the people that we need to. And again, U.S. leadership is essential to this cause, and I really look forward to working with all of you in this room to make sure that can